Hello everyone, I'm Akushla. I'm a physiotherapist and a third year PhD student at School of Healthcare Sciences, Cardiff University. This study is a systematic review with meta-analysis, and in this review we try to identify what is the effect of low back pain self-management interventions with exercises, and also whether there is any effect of tailoring exercises within these interventions. Let me talk to you briefly about the background of this study. When it comes to low back pain management, both exercise and self-management are highly recommended, especially within national and international guidelines such as NICE guidelines and European guidelines for low back pain management. However, according to the existing literature, self-management programs for low back pain show poor overall outcomes. And despite of the recommendations, most of these self-management programs do not have significant exercise components in them. Also, with exercises, it is recommended that tailoring of the exercises to the individual as much as possible. But again, when it comes to the existing self-management programs, this is not always the case. So with available evidence, it is not clear what is the effect of self-management interventions with exercises, and if this tailoring of these exercise programs to the individual produce superior effects on low back pain and disability compared to general exercise programs. So there were two key objectives for this study. The first one was to determine the effects of self-management interventions, including an exercise component, on low back pain intensity and disability. And the second one was to determine whether self-management interventions with tailored exercises have superior outcomes compared to self-management interventions with general exercises. Moving on to methods, an electronic search was conducted using 5 databases for randomized controlled trials. These included PubMed, Medline, CINAHL, Embase, and Cochrane Central Registry. Trial methodology quality was assessed using Cochrane Risk of Bias Tool 2 for randomized controlled trials, and the quality of evidence was assessed using GRADE framework. Pain and disability were the two key outcomes, and data was extracted at 3 follow-up points, including short-term, intermediate, and long-term. Now let's have a look at the results. This is the Prisma flow chart of selection of trials. From the electronic search, we identified 1987 studies, and also 8 records were identified through cited references. After removal of duplicates and screening of titles and abstracts, 183 full articles were assessed for eligibility, and we ended up with a total of 12 studies which were included in the review. Here in this box you can see all the reasons why we had to exclude the rest of the full text articles. Next slide shows the risk of bias summary of the included trials, which was evaluated using Cochrane Risk of Bias Tool 2. And in overall, methodology quality of the studies were moderate. As I mentioned before, the first objective of this study was to identify the effect of self-management interventions with exercises on low back pain intensity and disability. This slide brings you the results of the meta-analysis of effect of self-management interventions on low back pain intensity. Here you can see the forest plots and the pooled effect sizes at each follow-up points, short-term, intermediate, and long-term. As you can see, self-management interventions have moderate and significant effects on pain intensity compared to controls at all short-term, intermediate, and long-term follow-up points. Similarly, we conducted a meta-analysis to find out the effect of self-management interventions on disability. And as you can see in these forest plots, the pooled effect sizes were in favor of self-management interventions compared to controls. And from the numbers, we can see that self-management interventions have moderate and significant effects compared to controls at all short-term, intermediate, and long-term follow-up points. To answer the second objective, we conducted a subgroup analysis at short-term follow-up point. We subgrouped the studies according to the nature of the exercise components, whether they have tailored exercise components in the interventions or whether they have general exercise programs. Then the effect sizes of pain intensity and effect size of disability were compared. Here we can see that in the interventions with tailored exercise components, there was a significant effect on pain intensity with a p-value of 0.004, whereas in the interventions with general exercise components, there was no any significant effect towards pain intensity. Similarly, interventions with tailored exercise components had a significant effect on disability with a p-value of 0.002, whereas again in interventions with general exercise programs, there wasn't any significant effect. So, in conclusion, there is moderate quality evidence that self-management interventions with exercises have moderate but significant effects on low back pain and disability compared to control interventions across short-term, intermediate, and long-term durations. And self-management interventions with tailored exercises have superior effects on pain and disability compared to interventions with general exercise programs. Therefore, we conclude that it is important to develop tailored exercise solutions supporting self-management to improve its effects on pain and disability in low back pain patients. Thank you very much, everyone.